Hey Refam, my name's Kate and welcome back to Keeping It Real, the podcast so good you wish there was two of them. Today we're talking twins and more specifically the impact on the women who birth them. Did you know that the average woman's uterus grows to 500 times its usual size in pregnancy? And that's just single births. Today, Kim and Richard discuss why even though global rates of birth are going down, multiple births are actually increasing. We also cover if it's more likely that you'll need an abdominoplasty after giving birth to twins, and if it's possible to still get a good result after doing double the breastfeeding. You'll also hear me spiral in real time as I try to understand when twin mums have time to do literally anything. If you know a twin parent who will enjoy this episode, please share it. And as always, rate and review Keeping It Real wherever you listen to podcasts. So today we had a comment asking us to talk about multiple births, and I thought, great idea. And so by that, I'm talking about, for the majority, twins, obviously, but any time that a woman is pregnant with more than one baby. Even though the rates of women having children is going down globally, the rates of multiple births is actually going up. Do you have any idea why this phenomenon is happening?
Well, there's probably a couple of issues or reasons why. Firstly, IVF is more common, and although twin or multiple pregnancies with IVF is not as high as it used to be, it is still higher than non-IVF pregnancies. The other reason relates to women getting pregnant at an older age. So as women get older, the hormones are different. They have a thing called hyperovulation, and so that increases the risk of having a multiple birth pregnancy.
Just some data on that. Data from England and Wales in 2023. So in terms of you saying that it's happening with older women, for women under 20, it's 1 in 2,000 was a multiple birth.
Yep.
For women aged 35 to 39, this rises to 1 in 57.
Wow.
Then
What age was that?
from
Under
35
40
to
still.
39.
Okay.
Wow.
1 in 18 babies in Australia is born via IVF as of last year.
Wow.
And the average age of female patients in 2021 was 36, with 1 in 4 aged 40 or older, while the average age of male partners was 38. So obviously that speaks to what you're saying, that it's higher with age as well as IVF. But also just IVF rates in the UK in 1991, there was 6,700 cycles, and in 2021 there was 76,000.
Wow.
And in Australia, I think last year there was 106,000.
Yeah.
So,
But a confounding factor also would be that on average, women having IVF pregnancies are probably older than women having non-IVF pregnancies.
yeah,
So
definitely.
they get the double whammy
Yeah.
risk.
Yeah, for sure. In Australia, around 1.5% to 2% of births are multiple births, which doesn't sound that high, but that actually means twins happen 1 in every 70 births. So 1 in every 35 Australians
Yeah.
is a twin.
We know someone
Can't believe
who's
it.
family friends. She's very young, just had twins.
Yeah,
Yeah.
scary. The
In her,
risk is
in her
everywhere.
20s. In her 20s. Amazing.
Wild. In terms of women you're seeing for consults, does that seem representative, that 1.5%? Do you think it's overrepresented, the amount of women coming in here for certain surgeries that have had multiple births?
I had never thought about it until you asked, but I would say probably not. I can recall it would be less than 10 patients that I think that have had twin pregnancies. I don't think I've ever had any that have had more than that at once, and that's out of hundreds of patients. So I think my rate would actually probably be lower than that.
But 1% is such a small number.
Yeah, true.
We're just...
Yeah, if you had one a year, like it's...
I wanted to ask about the kind of physical impacts that might be unique, not unique to multiple births, because I'm sure we'll see this in singleton babies as well, but things that are quite common that happen amongst women who've had multiple births. Starting with abdominal muscles, what's a very common impact there?
It's like a single pregnancy, but twinned. So I just saw a patient before who'd had 2 previous children. One was, I think, 5.5 kilos. The other was 4.8 kilos.
Wow.
Separate pregnancies, not twin pregnancies. but she had quite severe muscle wall laxity and a muscle separation or divarication of her recti. But that's what you would expect to see in a twin pregnancy as well, because often twin babies are a bit smaller, so they're not going to both be 5 kilos. That would be physically impossible. But the additive effect might be up to 5 kilos or 4.5 kilos or in that range. So we'd see those same effects. I think there's a lot of misunderstanding, predominantly because of the MBS item numbers. And if you haven't downloaded our MBS ebook, please go ahead and do that. But because the item number is so tied to a muscle separation, people think that the muscle separation is the be-all and end-all of the damage caused to the muscle wall from a pregnancy, and that's not actually the fact. The muscle separation is part of the issue, but it's not the whole issue. So what happens with a large pregnancy, whether it's singleton or a multiple pregnancy, is that the whole muscle wall gets stretched. So all of the muscles, and there's sort of two main groups of muscles that go into the muscle wall. There's the central rectus muscle and then the oblique muscles on the side. But they all get stretched. So the whole muscle wall gets stretched, and part of that is the tissue in between the recti, which is what is the separation. So that's predominantly what we see in twin pregnancies, that muscle wall, as you would see when you see someone who's carrying a large baby, that muscle wall has just been stretched. And my patient today does Pilates, she's done physio, she's done everything you can possibly do. But when those muscles aren't aligned, it's very hard to get that tone back. And there's almost no way of really closing the gap. It will either close or it has to be repaired surgically if you want to have that fixed.
What about skin laxity and excess skin? Is there more when it comes to like twin pregnancies?
Absolutely, same sort of thing. So the bigger the pregnancy or the more weight that's gone into that specific area. And so sometimes you can actually see it with another condition where women have a lot of excess fluid around the baby.
Hyper something.
Anyway, but yeah, they'll say normal sized baby, but they had a lot of extra fluid. So you imagine that if the uterus is filled up with whatever, another baby or a lot of fluid, then not just the muscles are getting super stretched, but that skin is as well. And then it is a bit of genetics and a bit of good luck and whatever happens after the babies are being delivered, whether that skin will recover and contract back down to normal, which is pretty uncommon, or end up with laxity. And I think combined with what we're saying before about some of those patients that are having multiple births are a bit older, then their skin's got less elasticity, so more likely that that skin doesn't contract back down as well. And there's a couple of patients that I can distinctly recall that were very, very slim and had a twin pregnancy and had, like, you'd almost see the separation between the muscles through the skin because they were slim and they didn't have any extra fat, and they had a little bit of excess skin but a lot of muscle damage.
Often see the peristalsis. So peristalsis is how the intestines contract and propel food down the gastrointestinal tract. But in these very thin patients where there's a big separation, there's maybe 5 millimeters between the skin and the intestines. So if they're lying flat, you can actually sometimes see.
On the outside?
Yeah.
Absolutely.
You can.
Skin's so thin, there's nothing much between the guts and the outside world.
We don't want to scare people off having pregnancies. There's obviously a genetic component as well. And we see this with weight loss patients as well. Some people can lose 30, 40 kilos and their skin shrinks back down and you wouldn't have known that they had gained weight. And the same with pregnancies. So we can see women who've had large pregnancies and everything has pretty much returned to normal. And then you can see women also with smaller pregnancies who the muscles have really stretched up and the skin has also stretched up and there's loose skin. So there is a genetic component. But certainly the bigger the pregnancy, as Kim was saying, increase the chance that you may want to see one of us to have something done.
I don't know if this is a question you can answer, but I was obviously thinking about breastfeeding. And then I was like, God, how do they have to produce double the milk for double the baby? But is that something that people are coming in commonly, they're seeking out breast surgery?
Basic economics, Kate. Supply and demand.
I just don't understand.
Yeah,
When do they sleep?
definitely one of those patients that I just previously mentioned had very, very empty and very ptotic or droopy breasts because had been, basically like a milking machine. Like you've got two babies that they have very little time of the day where they're not feeding one of them, and if not, then pumping of it as well. So there's a lot of demand on the breasts that are then increasing in size, decreasing, increasing, decreasing, twice the amount essentially.
Yeah, right. Yeah, what are common surgeries that multiple mums, I don't know what their name is, mums of twins, are coming in to see you guys for?
Well, the most common would be tummy tuck because that's probably the biggest area that gets stressed. And then second would be breasts, and the breast procedures I'd group under a breast reshaping procedure, so it might be a combination of a breast reduction and a breast lift, and then some who've lost a lot of volume and are wanting an augmentation. But generally in that group, there would often be a lift associated with an augmentation. Some of them would just be a primary augmentation, but particularly if they had multiple pregnancies, there will be some droopiness, ptosis of the nipple and breast tissue. So it'll be a breast reshaping and then maybe an implant.
Is it common to combine those surgeries, or do you recommend staging?
It would be very common to combine those surgeries, and I guess depending on how droopy the breast is, breast procedure may need to be staged. So if they're very, very droopy breasts, then the breast lift and or reduction can be combined with the abdominal procedure. But then if they wanted an augmentation, that may need to be delayed for 9 to 12 months afterwards until everything's settled down. If that was purely a lift or a reduction or an augment without necessarily needing a combination of any of those things, then that's easier to combine with an abdominoplasty.
For me, there is clear criteria when I'll do an implant at the same time as a lift, which I go through with you in a consultation. But essentially, I don't want to be moving the nipple too far. So my sort of cutoff is around 2 or 3 centimetres. Also, not wanting an implant that is too big. So by that, around the 300cc mark. Once it's bigger than that, I think it's putting too much sort of stress on the skin because you're making the skin envelope smaller. And the third thing, which you need a visual for it, is not having an areola that's too big, because otherwise you get what's called areola bleed because you need to cut through the old areola. So there's my criteria when I'd go 1 stage versus 2 stage. But same as Kim, I generally err on doing 2 stage, which kind of works quite well because these patients often have very stretchy skin, and so getting the breast shape right prior to doing an implant is often a safe way to proceed.
Combination of doing the breast and the tummy surgery at the same time. The great benefit of that, particularly when you've got young, small children, is it's one surgery, one lot of recovery. And because the abdominal procedure is generally the more uncomfortable one, then the breast procedure you tend to not have that extra recovery.
How long should patients wait after giving birth to come see you guys for a consult?
I would generally say we unlikely to operate on someone before 12 months postpartum, but can assess them once everything's stopped changing, essentially. So once you've stopped breastfeeding and your breasts have returned back to their new normal, and again, once your abdomen is stopped improving, usually, because there will be a good number of months after giving birth that's going to completely settle down. Also, you've got newborn babies and maybe other children. So the priority for that first 12 months really should be on looking after the newborns. But generally, I'd be happy to do a consultation with someone beyond 6 months postpartum, but with the knowledge of we're not going to be booking you straight in, but assessing, see what may need to happen, whether you need to lose some more weight or other things like that.
I know obviously women who are pregnant with twins or more would feel like their bodies had changed an insane amount throughout that pregnancy. Do you think that there's a difference in that it's any harder to get a good result after that change, or does it seem pretty similar to other patients you have through?
Pretty similar. In some ways, I would say worse the changes after the pregnancy, the bigger the improvement is. So if you've got a small separation, a small amount of muscle wall laxity or skin looseness, it's an incremental improvement. Whereas after women who've had twin pregnancies, the muscle separation can be so severe and the skin looseness is so significant. I think the end point you can reach is going to be similar regardless of where the starting point is. So the further behind the eight ball you are, bigger the improvement's going to be, if that makes sense. So I don't think it limits the end result you can get to, all other things being equal, that you're at your goal weight, you're fit, you're healthy. It doesn't do anything to the tissues to restrict us, how much skin we can remove, how tight we can make the tummy muscles, all those sorts of things. So it's just the amount of improvement from your starting point makes the result maybe more dramatic for the women who've had bigger pregnancies or multiple pregnancies.
And I think the converse to that is women that come in with really minor concerns of their abdomen, so a little bit of loose skin or a few fairly minor stretch marks above their belly button, which are clearly significant for them because it's quite different to where they were before a pregnancy. But the operation of an abdominoplasty is the same whether you're minor problems or major problems. And so I find they're a lot harder, and often would be counselling them to be like, look, surgery is probably not the best thing for you because it's major surgery and it's a minor issue. So it's a lot harder to get a radical improvement.
Do you have any recovery tips for people who are needing to recover from these pretty major surgeries if they do have multiple children at home?
It's very rarely us who is limiting when you can have your surgery after pregnancy because you've got little children. Having your child at the stage where they're walking certainly makes things a lot easier because carrying and lifting is going to be hard, particularly in that first couple of weeks. So some things you need to do, you need to have a supportive partner who is going to potentially be able to take some time off work or have another family member who's going to be around during the day just to help you with showering, with all the sort of normal daily activities, a little bit of meal prep and shopping prep prior to surgery so you're not having to race down to the supermarket. Obviously now there's online shopping, so that can also help. Driving is something you probably can't do for a couple of weeks, so you need to arrange rosters if you've got kids going to school and make sure they can be attended to and after-school activities. Other than that, people talk about having recliner beds and special pillows, all those sorts of things. I think those things may be helpful. Majority of our patients don't use them. So lying in bed with a couple of pillows under your knees just take some tension off your tummy is fine. Lying on your side, curled up, curled up in a ball, that can be more comfortable. Showering from day one is fine. Having water on the wound is not going to be detrimental. But I think the key is really just having your support networks around and ready to pitch in and give you some help so that you can get the rest and recovery that you need and bounce back as quickly as possible.
Have you had any of that consistent feedback of long-term outcomes from patients that have come to see you that have had multiple births?
We have. I don't think they differ. I think if you're at home, you're watching or listening to this podcast and you've had a large pregnancy or you've had a twin pregnancy, I think you can be optimistic in terms of the long-term result. There's nothing in having a twin or multiple pregnancy that would mean your long-term result is not going to be as good as anybody else might get, a single pregnancy. They don't really stick out in my mind because I don't treat them any differently to anybody else who's come to see me for a tummy tuck, whether it's weight loss, single pregnancy, or any other variation. So they don't stick out because their results aren't as good or they're not as long lasting. I think if you're considering this surgery and you've had some of the problems that we've described, I think you should be optimistic about what we can achieve and what the long-term result could be.
Ideally, don't have a multiple pregnancy after you've had the surgeries or any kind of pregnancy. Have abdominal surgery in particular once you've completed your family.
That is true, but some people sometimes get this a bit confused as well. There's no problem getting pregnant after you've had a tummy tuck. So it may detract from the final result if you have a subsequent pregnancy, but there'd be no problem with either getting pregnant, carrying the pregnancy to term, delivering, None of that is going to be impacted, but it may mean that you end up with some laxity in your tummy wall, some loose skin. It may not. It is hard to predict.
You've definitely had one patient, haven't you?
I've had a number of patients who've had subsequent pregnancies, and for some of them it's made
quite good results.
Yeah, some of them it's been fine. For some of them, it's just like not certainly.
Starting from
we wish a higher percentage of women who have children came to us for surgery. That'd be great. But the reality is the majority of women after a pregnancy don't require a tummy tuck. So the same would go if you have had pregnancies, had a tummy tuck and then had another pregnancy. But I think it's important to distinguish whether it's going to impact the result versus whether it's going to impact a subsequent pregnancy. Those two things are very different.
If you liked that episode, there's plenty more where that came from. Maybe start with some of these or head to our channel for your peek into the mysterious world of plastic surgery.